This is supplied by Synca. The system is called Brilliance 20. Included in this kit, you'll have your prefab tray system, which is a combination of hydrogen peroxide and carbon peroxide. You also have your touch-up syringes, which is what you're going to give to your patient after the procedure is done. Also included as part of the treatment is a vitamin E ointment for you to protect the tissues. There is a liquid barrier and a cheek retractor and some gauze. What's really important for the procedure itself is always make sure you actually have your bleaching whitening guide. This is obviously setting the proper expectations for your before and after for the treatment that we're going to provide all together. We're going to do a shade reference. Okay. I'm going to match the color first. We're going to do some before and some after pictures, and then we'll start the procedure, and I'll explain the procedure as we go through it. Okay. Okay? Give me a big smile. Okay. So we're just going to do a couple of pictures to start off with. I'm going to get you to do kind of like an end-to-end smile. So put your teeth together, and we want to see all your teeth. Now the goal of having an end-to-end bite is a lot of times seeing that full smile and being able to see the transition that you may see in the tooth coloring itself. When you take pictures, the key thing that you really want to look at is you want to make sure your camera is parallel to the tooth surface so that you don't get shadows on the tooth itself, and make sure you're not getting any of the reflections on the enamel. Enamel naturally is very reflective, so if you actually have light hitting it, it's going to give a false positive in regards to actually what shade the color is. Okay. Now I'm going to get you to do a natural smile for me now. And the goal of doing the natural smile is, at the end of the day, is when we do teeth whitening, a lot of people hold their teeth in an awkward position. The natural smile is really for them to assess it on their day-to-day lifestyles in regards to making sure that they're happy with the outcome altogether. Okay, we're going to do one more. It's always good to actually show the shade reference as well. So we'll line this up and give me an end-to-end smile again. Perfect. Hold on. I got to reset my camera. This way. One thing with this whitening procedure is very important is to actually have your patient sitting upright. Previously, a lot of whitening procedures, you'll lie your patient down. What we found with this system is if your patient's actually sitting upright, they're more comfortable, they can actually swallow more properly, where they won't feel like they're breaking down the gel as quickly, and it's more comfortable in the long run for the patient. Okay, we're going to place the cheek retractor first. Idea of the cheek retractor is just basically pull back the lips and the cheeks so that it doesn't come in contact with the gel during the application of the liquid down. I'll get you a bite down now together. Once you have this placed, you'll see it opens the vestibular area. The key thing when you're actually applying the liquid dam, and because this is a hydrogen peroxide concentration, is you want to make sure the gums are isolated properly. If for any reason if your gums have sensitivity, it's usually a clinician error that you didn't seal the gums properly with the liquid dam. The key to do this is making sure the gum tissue is absolutely dry. Concept of holding your actual liquid dam, we tend to try to use it as a thumb and your index middle finger to actually hold it. Best way to control is actually use the bottom of your palm to actually release the pressure to control the flow of the actual liquid dam. Okay, key is always start on the very bottom, not on the top. So you want to dry the tissue, and then you just start usually from premolar to premolar. So we'll have our patient turn towards us. So basically you want to start right at the gingival margin, and the process itself is about 1 to 2 or 2 to 3 millimeters depending on the type of smile and gum line or gingival margin based on the teeth positioning. So you basically just release it and you control it and you go all the way around. So could you open up just a little bit there? Good. And you can see as the tissue is dry, the flow of the actual liquid dam is very smooth. One of the benefits of our liquid dam is that it actually adheres together, so you can actually stop midpoint, cure it, and start from the same point again, and everything will harden. So we're just going to cure this here, and then we'll do a final touch-up afterwards. So the curing time takes about 10 seconds. You can use the light for the whitening to actually do the curing itself. It is actually at the same wavelength. Once it's actually cured, you'll find that it actually hardens. So from touching it now, you'll find that it actually doesn't move around. Now you just have to start on the top. So you want to dry all the tissue on the top, and it's the same thing. So you want to start right around the premolar area, and you just want to trace along the gum line. that. So once the first part, I always go back, just double check, make sure you've covered all the distals, make sure it's fully sealed, just so you don't have any discomfort that the patient may experience from the hydrogen peroxide in the tray. And do one last, just to cure it, make sure everything is fully sealed. We're going to remove the cheek retractor now. So once this process is done, biggest benefit of whitening is making sure you have proper contact time with regards to the gel. So that's a lot of times where you're going to remove the cheek retractor to ensure that it actually sits properly when you seat the tray. When you actually open up the tray, make sure when you're removing it from the package that you actually pull the packaging away from the tray itself, just so don't you end up contacting the gel for it to come out of the tray altogether, okay? This is a universal tray system, which means there is no top or bottom. The gels are equally loaded on top or bottom. The idea here is when you place it, it's placing it center as possible and making sure the gel is covered the two surfaces accurately, okay? When you're placing the tray itself, most important thing is always placing the max first and then having the patient slowly bite into the tray. If the patient actually bites down too quickly, that's a lot of times when the gel will actually shoot into the actual palatal or lingual area, and that sometimes is where you would get that slight hydrogen burn, which is kind of like having a sunburn, okay? Typically within 24 hours, the tissue will heal itself. It's nothing that's permanent in regards to damage or anything for the patient itself, okay? So placing the tray, idea is you always remind your patient to bite slowly. You're going to see it properly. So if you look at our patient today, the way that her teeth line up, they're actually slightly shifted towards the right. So even when you place it, you always want to guide it properly so you have even displacement of the gel. So I'll get you open nice and wide. So you just want to place the gel on the top, and then you just want to slide it in. Okay. Once you have the top in place, you slowly get them to guide their bottom jaw into placement, into the tray itself. And you can slowly bite down into it. Good. So once you have it, if you take a closer look at the gel right now, you'll see that there starts to bubble right away. The bubbling is the hydrogen peroxide. As soon as it's in contact, you'll get that oxidation response. Typically, over time, the purpose of the light is it's the carbon peroxide that you're trying to break down, okay? Once your tray is in place, what you want to evaluate is make sure there's no gel coming out of the top. So a lot of times, get them to lift their lip up. And concept, if there's any gel that's on the top, you wipe it away, and then you check on the bottom. And if there's nothing there, then basically you try to get them to bring their lips all around the tray itself. Then you just got to remind your patient that they can breathe and they can swallow. You set your light for 20 minutes, and then the process will start for the next 20 minutes. So the idea of this light itself, it is an LED light. It's not a halogen light. Concept of the LED light is it's to actually break down the carbon peroxide. Hydrogen peroxide typically will break down naturally. You don't need the light to activate it. Idea of the carbon peroxide, it's usually wearing time. So the longer you have it on, that's how it breaks down into your hydrogen peroxide molecules. Concept of the light is to speed up that process altogether. Okay, and as I had mentioned before, the tray itself does include xylitol and potassium nitrate. So the goal of the potassium nitrate is to really kind of prevent the teeth from having any sensitivity. The xylitol helps stimulate salivary flow after the procedure is done, so you're getting your calcium phosphate ions are in your saliva to help with remineralization. After the 20 minutes is done, you're going to remove the tray. We've already had our patient rinse already, so a lot of times you'll find after we remove the tray, a lot of the gel actually stays in contact with the tooth, and hence why there isn't much gel left in the tray itself. The goal of having the gel stay on the teeth is that proper application time, where you get that proper contact time to have the chemical process to occur. Once the procedure is done, it's always important to take that after pictures. In order to get the best pictures, a lot of times is making sure that once again your camera is parallel. With the liquid barrier, a lot of times you can remove it. One recommendation I do have is if for any reason, if your patient feels, they wanted a little bit whiter or they wanted to achieve a little more of an outcome, this type of liquid dam you'll find that actually stays on the teeth itself. So you can actually just open up another kit and seat the trays again. If you are happy with the outcome altogether, the gel itself actually comes off very easily, or the liquid dam comes off very easily. You just have to place your finger on it and it pops off and it comes off as one solid piece. So the goal of that is for patient comfort. You don't have to be picking off the liquid dam or causing any kind of discomfort overall for the patient. Okay, maybe instead of you making her flinch, is it usually comes off as one solid piece, okay? At the end of the day, you always want to do your evaluation, take a quick look at the gums, make sure there isn't anywhere that you see the whiteness. If you do see any whiteness, a lot of times that means there's been some kind of application where the gel has come in contact with the actual teeth. So in your kit, as I had indicated previously, is you actually have vitamin E ointment. You can actually bend it right where that red line is to break it open. The vitamin E ointment will actually soak up the bottom of the Q-tip. A lot of times if you do have white spots, it's to just coat the area to help with the healing process. Basically, you just actually massage it onto the area. As you can see for our patient here, there isn't any white spots, so this is just really for a demo purpose to show you how that actually works all together. Okay? For your final shades of what you're looking at, typically it's the same pictures that you'd want to achieve right from the get-go. Goal is you want that natural smile, the end-to-end bite, and the best way to drive home that message is you take the original shade color that you actually had and you place it against the end result so that patients actually see the difference that you were able to achieve. After the procedure is done, post-care instruction and maintenance becomes very important for whitening. So the system that we did with Brilliance 20, the tray that you actually perform the in-office treatment with it is actually a take-home tray as well. So what you basically do is after you remove the gel, wash and rinse the tray. Then with the touch-up syringes that are provided in the system itself is these are 22% carbamide peroxide. You basically break off the tip and you want to actually place the gel right along the front side of the tray. You typically only need to do about one row of gel treatment, never past the midway point. The idea with take-home maintenance is less is more. You just want to have enough to cover the actual tooth and not so much where you feel like it's impinging on your gums, because that's a lot of times when you'll have the discomfort, okay? Wearing time for 22% carbamide peroxide is typically half an hour. You don't need to wear it any longer than that. Typically, the actual concentration will break down within that time frame, okay? As part of the kit, you also will get your vitamin E ointment. This is always recommended to take home for the patient as well. Idea is if you end up burning your gums or anything like that, it's making sure that you can actually treat it properly so you don't have any discomfort that you may experience. After the tray is done, you just basically take it out, you rinse it under water again. Anytime that you're about to place the gel in, also make sure that the tray is absolutely dry. Naturally, whitening gel tends to attract to water, so it'd be very hard for you to control the placement if the tray is wet itself, okay? Most important thing after you've done whitening or during the time that you're doing any touch-ups is there's always that instruction. So if you do drink red wine, coffee, tea, if you have a lot of pigmented foods, it's always recommended to avoid at least for 24 to 48 hours. If for any reason, if your teeth are a little bit sensitive, if you say I do feel a little bit of tingly sensations, typically you can use any kind of toothpaste that will help manage sensitivity with that altogether during the time frame that you're doing your whitening.